Hello, and welcome to another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Foundation. My name is Laura Esfeller. I'm your host, and we appreciate the sponsorship from Merck as well. Thank you to Merck for their wonderful support of this podcast. And I am really excited today for our guest, the lovely Rachel Funes. I met her a few months ago. Was it, Rachel? Was it really that long ago?
I think it's March.
Yeah, I think it was March. I met Rachel at the American Urological Association's annual meeting, and I knew that I just had to have her on. Rachel, welcome to the podcast.
Thank you for having me. It was so good to meet you.
I know. I love whenever things just come together. And so thanks for coming on today. Rachel, I wanted to start with the beginning. So what's your connection to kidney cancer, and how did you first get on this journey with us?
Okay, so it really started when I was I'd say 6 months postpartum. And I started losing weight really rapidly. And I'd also been working out really hard. I was trying to bounce back. And then I felt like I was bouncing back a little too hard. And I'm like, okay, I'm feeling exhausted all the time. I'm losing a little too much weight. I just wanted to get toned, but I could start to feel like a little bit of a hard something on my right side of my abdomen. And I thought it was like diastasis recti or something birth related. They say it takes 2 years for your organs to go back where they belong after birth. And I don't know, I'm a new mom. So I just gaslit myself and said it was fine. Of course, I'm tired. Of course, I'm losing weight. I'm working out hard. But I went to a physical therapist that I was actually asking about what I thought was the diastasis recti. And I owe her everything because she's the one that told me that wasn't normal. Yeah. And she immediately was like, you need to go to your doctor and have some kind of scan done.
So the physical therapist is the one that said something's wrong here.
Yeah.
Yeah.
So that freaked me out. But I didn't think it was anything like cancer. I just thought, that's weird. And then I couldn't wait to get my CT results. So I went to my OB because at first I was angry and I'm like, how have I had all these ultrasounds, given birth, and nobody knew that there was a 12-centimeter mass?
Wow.
That's a little
big mass. Yeah.
Yeah. How do you see that? When I saw him, he was like, oh, I'm not worried about it. I bet it's a teratoma.
At 12 centimeters?
Yes.
Oh my gosh. Wow.
He was like, it's gotta be a teratoma. So
you were still gaslit? Yeah. Wow. Yeah.
And honestly, I switched OBs after that.
Yeah.
I was uncomfortable. He really made light of a lot of things. Like when I first requested to go to a physical therapist, he wouldn't give me the referral.
Wow.
So it took 6 months longer than I wanted.
Yeah.
And with her, because he kept saying we need it. Wow. But she saved my life. Like that was a 12 mass in November. Who knows what it would be now? And at the UA, there was actually a doctor I met who had a really interesting philosophy on chromophobe and women. He thinks that the growth hormone that your body is producing to grow your child, it's similar to the growth hormone that we produce breast milk with.
Oh, wow.
And he thinks that there's a link between that accelerating tumor growth. So it growing to 12 centimeters, maybe usually chromophobes slow growing. It would make sense why all these younger moms all of a sudden are popping up with chromophobe.
Yeah, that makes a lot of sense. Chromophobe in general usually happens in women, right, and younger. So I think that's part of it too. I don't have chromophobe, but similarly, I was a lot younger than the quote unquote typical kidney cancer patient. And I think makes it even harder whenever you don't present as a typical, and a lot easier for people to just overlook your symptoms. So did your physical therapist send you to the ER, or did you have to go to your care to get a scan done?
I went to my primary care doctor, and that was interesting. She immediately, the one thing that I'll say, she is prompt. She's really quick to make everything urgent, and she just made me feel really cared for. But she has no bedside manner. So she's feeling around my stomach, and she goes, "Oh my God, that is large."
Oh,
Yeah. So that's her demeanor. And when they found out it was on my kidney, not my ovary, because at first we were thinking maybe it's on my ovary. And when the imaging came back and she called me, I was like getting ready for work and she's Rachel, your results are in. It's on your kidney and it's large.
Wow.
What do you say to that?
Yeah, your whole world just changed. Yeah.
Yeah. I'm like, what does that mean? What does that
Right.
mean? It's on my kidney. Like the way she was saying it implied something that I didn't know. You know what I mean?
Yeah.
What am I missing? How serious is this? Like, I've
Right.
never had anything like this happen.
Yeah.
Yeah, that was really scary. And like dealing with her, like, kind of lack of bedside manner.
Yeah,
Like, I
made it
like,
harder.
girl, yeah, I appreciate her in the sense that she never made me feel like everything was so urgent, but she just didn't really have a soft way of delivering anything. And I needed that softness.
Yeah, yeah. I think especially when you're early on, it reminds me I had an oncologist who only treated me very briefly, but yeah, his way of telling me that my cancer had continued to metastasize after my surgery was he just walked in the room and said, "Your cancer's back," and you're like, "What? What?" Yeah,
Oh, I don't like that. Yeah.
it makes it that much harder to process the news. And I imagine that you were probably like me, which I hadn't really given my kidneys any thought since like high school biology.
Yeah, same.
And whenever you heard, when were you actually diagnosed with chromophobe? Was it after your nephrectomy?
No, so that was what was really nerve-wracking. I was first diagnosed stage 2, grade 4 clear cell.
Oh, wow.
So I had to wrap my brain around that. And I am like every other newly diagnosed person. I'm obsessed with Googling my specific stage 2, grade 4, 12-centimeter mass. Like everything I was reading was so depressing. It was like, the 5-year prognosis was like 15% chance I'm going to still be here. So I'm looking at my baby and I'm thinking like, okay, maybe I'll get to see her turn 5. That would be really hard to think about, but maybe I don't get to see her turn 5. That's even harder to think about. Like that's where my mindset was. And 2 days before I was supposed to start immuno, I got a call on a Saturday from my doctor. My urologist called me and he was like, "Hey, has your oncologist called you yet?" And I was like, "No, it's a Saturday. What's going on?"
Really? Yeah.
Every fear known to man comes to mind. They're going to tell me it's both kidneys. They took the wrong one. I don't know what they're going to say.
Yeah.
Which that would be morbid if they accidentally took the wrong one.
But yeah, your mind
they
goes
do
all
the
over.
marker. They always write their name on your that way. So reassuring in the moment too. Yeah. So he calls me and he tells me that they got a second opinion from the Cleveland clinic.
Okay.
And they said it was actually chromophobe. So then I didn't know what to think because I don't know anything about chromophobe. So the more I learned about it, it was funny. Me and my mom actually got in a little squabble on the car ride back because she just didn't understand I should just be happy. It's a less aggressive cancer. It's a better quote unquote prognosis. And I felt like I wasn't really allowed to process everything. And I think that there's some like unspoken survivor's guilt that we all deal with when you have friends that are in less fortunate situations, or unfortunately, if they metastasize or if treatment's not going well for them. Like it's really hard when you used to like sit in the same space and all of a sudden you want to throw your friend a lifeline, but you can't. And when you get good news, I don't know about you, but I almost feel bad for it.
Yeah,
You know?
I still struggle with that. Yeah.
Yeah, like I cried. Like the first like few minutes, I was just in shock and I didn't believe it because the whole time I'm thinking clear cell. And when they said chromophobe, second opinion, I'm like, maybe I need a third so I can get 2 people to say the same thing for peace of mind. So I know, who do I trust? Yeah.
Yeah. Especially when we've already been through the ringer with the medical community, right? It's like,
Absolutely.
what now? What is this second opinion, right? Yeah, I think it's really common. And yeah, I think survivor's guilt, it's chromophobe is typically less aggressive, but it's still kidney cancer. It's still right.
Yeah. And I don't know about you, but like for me, when I think about, I love you and I both know Dina, and I love her expression, there's no such thing as a good cancer, because there's not.
It's true.
All cancers can metastasize. Predictable. And no, there's no such thing as a good cancer. And I have my own feelings when it comes to chromophobe because on one hand, you hear it's less likely to be aggressive or metastasize, but when it does, there's only really clinical trials. And it's not that clear cell or other subtypes aren't difficult also, but I feel like chromophobe for whatever reason, it's really picky about what treatments it does well with. It's
Right.
weird. Like it's really weird. Like how they don't do Keytruda. Well, I know they do sometimes as a last resort. Like you do a lot of things when you're having issues with treatment.
Yeah. Yeah, I think that's something that it wasn't until I started getting into more of the research advocacy side of things that I better understood because like you, whenever I was first diagnosed, I was like, okay, now granted at the time there were a lot less treatments on the market, but I was okay, there's some stuff for clear cell at least, right? But I'm like, what do I do as an HLRCC patient? Rachel, tell me, whenever it came time for you to have a nephrectomy, what was that decision-making process like? It sounds like your primary care was like, no. So did you feel rushed or did you feel like you had time to make decisions and understand that process?
I definitely did not. I really just felt like there was only one choice. That was really like I met with my urologist and found out that I had renal cell carcinoma, which I'd never heard of. And I was so just completely oblivious to the cancer world. Like both my grandmas have had different cancers, but they never used the formal names for them.
Sure.
So I just knew like breast cancer, lung cancer. Like
Right.
we never talked about like subtypes. And I know so much about cancer now and I hate that. But back then, like it was just so simplified. And when he was throwing all this jargon at me, I really was like sitting there in my head and I'm like, renal cell carcinoma. Like I briefly Googled kidney masses before I went in and I remember seeing renal cell carcinoma. And I remember thinking like, as long as it's not that, it'll be fine. And when he said that, I'm like, is he trying to say I have cancer? He would just say I have cancer if I have cancer. And I was just in such shock because I was like literally pumping while he's telling me I have cancer.
My gosh.
I was sitting there with my breast pumps on and I'm just blinking at him and I'm like repeating it in my head, renal cell carcinoma. What is that? And so finally, like he's going to leave and he's, okay, we're going to schedule you for surgery. We need to remove your kidney and open is the only option. There was no talk of robotic being an option.
Yeah.
Really, it was just, we're going to get you scheduled 6 days from now. We'll have it planned and then you can't lift your baby for 6 weeks. You need to figure it out. My husband was not home. So I had to do like a Red Cross message with the military to get him home.
Oh my gosh.
Yeah. And I might be able to get there the night of your surgery. So I'm thinking I have 6 days to fly my mom here or get my mom here somehow. I can take care of my almost 1-year-old. So I had almost a week to dry up because I'm thinking I'm not going to be able to breastfeed anyway. I'll be on treatment, what they were saying at the time. And yeah, it was just really stressful. I didn't, yeah, it was a whirlwind. It was the longest 6 days of my life, but it was only 6 days to prepare. And yeah.
Yeah. So I'm going to take a guess that discussion about like fertility planning and all that preservation was a discussion. If you'd wanted to have more children. Yes, that was just like, we just need to get you in to take your kidney out. Basically. That had to be so tough, especially you've just less than a year ago had your first child, right? At this point, I feel like it's like almost embarrassing to be like, what was that like for you? Where do you even start? How did you manage all that?
I really didn't. I feel that way too about anybody when I hear their story. I'm like, oh my God, how'd you get through that? You just do, right?
Yeah.
Sometimes like a zombie. Like I definitely was doom scrolling and Googling my symptoms and everything. Like I was so scared of my own shadow. Like after my nephrectomy, I didn't know what to eat. I felt like there was so much pressure on what to eat, having only one kidney and really just craving some kind of structure, like some kind of guidance to look to for the best odds of good survivorship. Like I know so much is out of my hands, but set me up for success. Help me give myself the best shot. And I didn't feel like I had that. Like I don't know anybody who has felt like they had that. I think there's such a lack of research and guidance for survivorship long term, especially for like young adults.
Yeah, I think that's where you're so right. And I feel like it's really tough because there's things with, so first of all, survivorship, I feel like is just such a relatively new topic. And it's not something that, I think that there's a lot of room to grow on how we handle survivorship as a community as a whole. Like, it
Absolutely.
needs to be not just survivors talking about it, but
Yeah.
clinicians and care teams too. I know that to be fair, there are some great researchers and doctors who focus on this, but I think we need more, to say the least. And I think you bring up a really good point, which is for me, where I really struggled, especially in the immediate aftermath, was there were some things that I definitely could relate more to fellow kidney cancer patients on from a survivorship standpoint, and just like recovering from surgery and all, right? Because the treatments are different in a lot of ways to cancer, right? And so a lot of the things that I was dealing with, I feel like only other kidney cancer patients could understand. But at the same time, my kids were in middle school when I was diagnosed. So, and I was 30 years on average younger than most of the kidney cancer patients that I knew. Like, I was really fortunate that there was a group of us that we found ourselves on Smart
Wow.
Patient. We realized that we all lived in Vegas. And so we would get together and have dinner once a month. Of course, we were all patients with the same doctor because there was only one doctor at the time in Vegas that really focused on kidney cancer. So it was really fortunate. And I loved those ladies dearly. Unfortunately, they've all passed, unfortunately, but they were
Wow.
incredible and such a source of strength for me. But they were like my mom's age. So they were dealing
Oh,
with
yeah.
like grandkids and having to postpone retirement potentially. And I'm like, I'm still in the thick of it, trying to figure out if I can go back to work and care of my kids and all those things. But then on the flip side of it, I feel like there's a little bit more resources within the YA, the adolescent young adult community for that. But I don't have a typical, and you don't have a typical AYA cancer. So it was like people that mostly have lymphoma and leukemia, which to your earlier point, no such thing as a good cancer to have, but their treatment looks very different. Their survivorship statistics look very different. A lot of it is very not only treatable, but curable. And so it's like,
Absolutely.
I felt like I didn't really fit in with them either.
Yeah.
And it sounds like you felt the same way.
Absolutely.
Yeah. It's really hard because I feel like that's where a big gap is for our community for sure. So, were there moments where you felt like you had to choose between taking care of yourself and taking care of your baby?
Absolutely. And I don't know, if I didn't have my mom here, I don't know how I could have done it. My husband was a huge help, but having my mom here just to talk to,
Sure.
like, I needed that so much more than I needed anything. Like, I just needed somebody that I could say all my irrational fears. Cause I feel like your brain goes to such a weird space when you've never thought about your mortality before.
Yeah.
And I don't know about you, you probably feel similar. I never felt like I was immune to cancer. I just never thought I'd have to worry about it at my age. Like, I thought,
Yeah.
in 40 years, maybe, it just feels so unfair when your little safety bubble pops like that and it changes you for the rest of your life. I think sometimes that's a hard thing for me. Like, you feel this weird, it's kind of like the pressure you feel as a mom to bounce back. I feel like you feel the same kind of pressure to like get over it, move
Right.
on. Nobody says it, but I don't know, like people stop asking you. And like it just, even though I can't stop talking about it, I think it's just weird. I get like self-conscious about that a little sometimes.
Yeah. Yeah. I think too, I think because a lot of people just don't understand cancer. And yeah, I stopped a long time ago posting whenever I'm grateful I have good scan results, but I don't even post about it anymore usually, unless it's with other kidney cancer, what in the Judy Nicholson group or something like that. Because I'm like,
Yeah.
I think most people are, oh, you're still dealing with that? I'm like, yeah, I'm still dealing with that.
It's crazy because if they were like in this community, they would totally understand.
Yeah.
Also, like how one in a million year story is like your body's responses to treatment, like all these things have been everybody's situation so unique.
Yeah, absolutely. So do you feel like, Rachel, that being a new mom gave you strength or did it just make it just that much more overwhelming? Or maybe, yeah, yeah.
I didn't feel like I had strength. Like I felt like I was just going through the motions like the first week or so. But I also was dealing with postpartum a little bit. Like I was knowing that I was going to have to stop breastfeeding when I didn't want to stop breastfeeding. I was already talking to my primary care doctor about getting on some kind of medication for postpartum depression before I found out I had cancer.
Wow. Yeah.
So I was just going through it. And I thank God for therapy. I immediately realized like I owe it to my child and my husband and my mom, especially now that I am a mom. Like I think about how heartbreaking and scary it would be if my daughter had a similar diagnosis. Like
Yeah.
yeah. And I just needed to get help, have somebody I could talk to and not worry about it being too heavy or feeling like I'm being repetitive. So that helped. Antidepressants definitely have helped huge and trying to stay busy. But that's somebody told me, I don't know if this is true, like needing to stay busy is also a trauma response.
I've heard that before and probably explains a lot about my life.
Yeah. But it makes you wonder, who am I when I'm not busy or when I'm not working on a project?
Yeah. I think it's because whenever you're busy, you don't have time to think about, to your point,
Yeah.
the dark places that it's not always the most comfortable going to.
Absolutely. Yeah.
Yeah. So, do you feel like there are any moments that really stand out for you, either really hard ones or maybe ones that gave you hope? You know what? I'm going to get through this.
It's weird. I just started to feel like life is going back to where it was. And I just had a friend give me a compliment the other day. She was like, "Oh my God, you sound like your old self. Manic Rachel is back." And I was like, "Manic? What?" And she was like, "Bubbly." I'm like, "No, you said manic."
Like, I heard you the first time.
And she said, "It's really bubbly. And I love that about you." And I was like, okay. I was like, I was a saddie. I was super sad for
Wow.
like everything had a tinge of heaviness. Like I just felt like I couldn't plan anything. I didn't know if I was going to be here or if I'd be on treatment or if treatment would work for me or like you're digging your own grave before you even have it. I just started really feeling like I'm like getting back to normal and I don't know what changed. I think just time going by and being fortunate enough to have good scans. Like I know that, sorry, that was my little one. I know if my scans weren't good, I wouldn't be in a good space mentally but I also think that that should be expected, right? Like,
Absolutely.
like I don't want to go through life like not feeling anything. That was my fear with antidepressants.
Yeah.
I got a scary diagnosis. I love my life. I don't want to lose it. I love being a mom. I don't want her to have to go through life without me. And not be in control of any of that. Like it's terrifying, but I don't want to not feel anything.
Yeah, absolutely.
But I think honestly, time is the only thing that really helps. Time and the support groups help, but the support groups can also be like anxiety inducing.
It's a double-edged sword for sure. Yeah.
Yeah. And I feel, I don't know about you, but I get like waves of time where I almost forgot that I had cancer, like different, like little bursts. So
Yeah.
I'm so sorry. But in those moments, it's like I just really want to enjoy that. And sometimes the support groups bring me back to that place.
Yeah.
That I'm trying to get away from.
Yeah.
Yeah, but at the
Sounds
same time, it's
fun.
nice to me. It does. And I really felt my advocacy place on TikTok. Like I post, I've been posting videos since diagnosis, just being vulnerable and like sharing with other people how it felt when I got diagnosed, what were my symptoms, things like that, like my updates on my CTs and stuff. And I found a really strong sense of community there. And I talked to those people on a more consistent basis, but I feel like it's different than like when I get on Facebook and I see a feed of which I had some skin stuff. That's why I have like a weird chunk of my neck gone. So I was on all the skin cancer pages too. So I'm seeing like every post is about skin cancer and kidney cancer. It was like
Overwhelming. Yeah.
Yeah. And it just makes you feel like you're like drowning in it almost. So sometimes like when I want to feel like I'm like in advocacy and still I remember how scared I was. I just wanted to talk to anybody that was in a similar situation. Know that they're okay. Know that like that's the sad thing. You go through the search bars and you look for like your specifics and sometimes you do find people that weren't as fortunate and and not wanting to accidentally comment on somebody's post who's not here anymore. That's so hard. And how do you know without doing a whole spiral?
Spiral.
Yeah.
So yeah, that's a great point. Yeah, I admit that I have not been as involved with the kind of the online groups, not because I think that it's an amazing resource, but for me, it got to the point where a lot of people that I connected with aren't here anymore, and so just got to where I was like, I need to protect myself emotionally and mentally, but then there's times where I'm okay and I go back. So I think that's really important, and you've done a great job of figuring out where your community is and also, okay, I have this resource where I need it.
Yeah.
I don't need to force myself to indulge in that right now.
Right.
Yeah.
Absolutely.
Looking back, is there anything that you wish someone would have told you early on?
I wish somebody would have just broken things down Barney style with me. What renal cell carcinoma is, what we're looking at as far as like surgery and recovery look like, what survivorship could look like with more structure. And freaking lie to me. Say it's going to be okay. Even if you don't know, like, I wish there was more of a, we're going to get through this together. I can't predict the future, but we're going to get through it. You don't even have to say it's going to be okay, but something along those lines to give reassurance.
Absolutely. Yeah. And what would you say to someone who's just been diagnosed, especially if they're also a new parent like you were?
Similar, whether I think there's certain times in life where you need to tell people that it's going to be okay.
Wow.
Because sometimes that's what you need to just get through that day. I can't tell someone it's not going to come back or they're not going to have other issues, but
Right.
I would just tell them it's going to be okay and they're not alone. I always see that on the support groups that it's not a fun group to be a part of, but thank God for this group because it gives you solidarity and support.
Yeah, definitely. How has life changed for you since surgery and treatment? And do you feel like you have new priorities in your life now, or are you just glad to be back to not manic Rachel?
I was like, manic. I don't know. I feel life, I'm just taking it day by day.
Yeah.
I really don't feel like it's changed too much of who I am in the sense of what I want my day to look like, but it has changed. Like I love the quote, that's a good problem to have. Like it's really put that kind of in the forefront of my mind. Like when something does pop up, I'm like, doesn't matter really what it is. There's nothing worse than the fear and panic we have when we're facing our mortality or a new prognosis, diagnosis. Like we don't want any osises. I really look at things like, oh, that's a good problem to have. Flat tire, good problem.
Yeah.
That can be fixed. And it helps me dismiss things that used to, before cancer, maybe would have ruined my day.
Yeah.
So I do feel like there's a better sense of gratitude.
Absolutely.
Yeah.
Rachel, anything else you'd like to share with our audience before I let you go?
I guess the one thing, maybe I would have said this to somebody newly diagnosed also, is if you are somebody who struggles with vulnerability, I was embarrassed by how uncontrollable it was. Like I was crying in public. There were a couple times where I just felt like I overshared with a stranger, or it's moments like that where you're just already going through it and feeling that embarrassment of being so vulnerable,
Right.
and maybe not wanting to be that vulnerable, but I couldn't really control it. I would just cry. I'd see a beautiful moment and think about how I won't get to see that moment, and just don't be embarrassed. Like it's okay. And embarrassment is a reminder that you're alive.
Love that. That's a really good way of putting it. Yeah.
Yeah. Thank you.
We are going to let you get back to motherhood and life.
Yeah, I'm gonna SOS. Come over and help me get this lipstick out the couch.
I'll be there in a few hours.
Awesome. Okay, good.
Yeah, but Rachel, thank you so much. This was really a great conversation. I'm so glad we connected at UA and really appreciate you coming on to share your story with us.
Yeah, it was great talking to you, Laura. Thank you. I'll talk to you later.
Sounds good. Thank you.
Thank you.
All right, guys, this has been another great episode of Real Talk Renal Cancer sponsored by Judy Nicholson Foundation. We will see you next month.